Hello, everyone, and welcome to the program. This is Sunday Politics live on Channels Television. I'm Sean Kimberley at Channels Television's global headquarters here in Lagos. Few minutes ago, the President Muhammadu Buhari addressed the nation on COVID-19 and how it has impacted on our lives. It then reeled out measures to stop the spread of the deadly disease. Let me show you highlights of his speech earlier today. The President announced a lockdown of Lagos, Ogun State, and the Federal Capital Territory for an initial period of 14 days with effect from 11 p.m. on Monday, 30th March 2020, that is tomorrow. He also announced the stoppage of movements of all passenger aircraft, both commercial and private jets. If otherwise, special permits will be issued on a needs basis. The President also ordered relief materials to residents of satellite and commuter towns and communities around Lagos and Abuja, and also of Ogun, whose livelihoods may be impacted or affected by the directives he reeled out today, and also measure for food and funds to the poorest of the poor in the society. These are some of the things that the President said today. We'll be bringing you some of the soundbite as we continue the program tonight. The figures of the case in Nigeria has risen to 97. A week ago, it was less than 40. But what more does Nigeria need to do? A lot of people have been speaking up. Let's give you an update of one of those who are already taking action from their own private capacity. Is the chairman and the vice chairman of Famfa Oil Limited, Modupe and Florenshaw Alakija, who have donated 1 billion naira to support the fight against COVID-19 in Nigeria. According to them, the donation symbolizes their resilience, character, and strength as they plan to work with the National Center for Disease Control, the Lagos State Government, African Center of Excellence for Genomics of Infectious Diseases, Dr. Amayo Stella Dadevo Foundation, Dr. Asa, medical workers on the front line in Lagos and Abuja, supply of medical equipment to relevant organizations, and the Commission for Refugees, Migrants, and Internally Displaced Persons. Mr. and Mrs. Alakija believe that the listed organization will decide on where to deploy their contribution for the need impact. Whatever you may be in Nigeria, perhaps you may have felt what your government in your state is doing. If you are in Lagos, from tomorrow, brace up for for some of the policies and implementation of what the federal government says will happen going forward. From the port, from the roads, and all that will be happening, the federal government will said it will take effect from tomorrow. Let's talk to those who are in the know. Perhaps one person that the president has trusted so much and met the president also yesterday. He briefed the president alongside the DG of the NCDC. He's the Minister of Health. He joins us tonight on the program. Dr. Osage Ehanire is in our Abuja studio. Thank you so much, Dr. Ehanire, for your time tonight on the program. I know it's a busy time for you, but Nigerians are willing to know more and how they can stay safe. Thank you so much for sparing this time tonight on the program. Let's begin by getting a feel of what this means altogether. Give us perhaps a summary of some of the things you discussed with the president yesterday, and perhaps the outcome of what the president said at 7 p.m. on a nationwide broadcast today. What are the other things that you probably want to put out there?
Well, the first thing is for Nigerians to understand that this is all for the common good. It is for the good of everybody in Nigeria, and since Lagos and Abuja are the epicenters for this disease, it is important that they are subject to particular regulations. And these regulations are to restrict movement of persons out of Lagos or into Lagos, and the same for Abuja, so that possible or presumptive carriers of this virus are not going to move unnecessarily to other states and then spread it in a way that it can become out of control. So these measures are extremely important, and they have been taken at the right time, exactly the right time when the threat appears to be looming.
A lot of people are wondering, you said earlier on that yesterday you mentioned that there will be 2 additional test centers. Give us a sense of what this means, where they will be, and perhaps how soon we are going to get more centers for testing.
As a matter of fact, yes, there are more than two. There is one that has come up now at the IDH in Lagos. It's going to come on stream perhaps fully tomorrow. Ibadan is also on stream already. And we're going to be working on Abakaliki, and right after that, Kano and Kaduna, where there's a private laboratory we're working with. There are other areas where the plan is to spread diagnostic capacity from Maiduguri up to Port Harcourt, and to start using the machines, the gene expert machines that we were using to diagnose tuberculosis, reconfigure them to be able to diagnose coronavirus. So these are all additional assets that are being deployed. Well, the strategy on the whole is strategy of containment. You want to make sure that this disease does not spread out of the epicenters, or at least to reduce the risk of spread. And that is why this movement restriction is necessary. It's a part of the strategy. The other part, as you know, is the social distancing, which is advised everywhere, and then the reduction in the number of people who can congregate, to also reduce the risk that if one person among them is a carrier and might not even know, he doesn't have the risk, he doesn't stand the risk of transmitting to others in the congregation. So those are all part of the strategies that we need to deploy. They might be inconvenient, but they are going to be very helpful in the end.
Minister, do you suspect we might have larger than we imagine in the country, perhaps the decision of the federal government and the president today to shut down Lagos, Ogun, and FCT, at least for 14 days? Do you suspect that we may have more than the 97 cases that we have currently on our hands?
Well, the disease spreads exponentially. One person can infect a good number of people if you make an assumption of 5, and each of those 5, for example, we infect another 5 and give you 25, and if you add the initial one person, is 30, and each of these will again infect another 5. So over a short period of time, you can have a huge number of cases in your hand. So the earlier you interrupt that transmission, the better it is for the entire system. And the strategy for interrupting transmission is to do everything possible to identify the index case, and then the primary contacts, put them on isolation at home, monitor them, and if they are showing any symptoms, carry out a test that proves that they have this disease or not, and put them in isolation so you do not have the risk of their being able to transmit the virus further. So this strategy is going to work. The more efficiently you are able to trace the contacts. It is possible that we do have more than 97. That's why the tracing and tracking is going on so efficiently. Lagos is doing very well in that respect. And the number we have now of those who they were tracking as of this morning or yesterday, I think it was 5,000 persons on the list of those who are being investigated as possible contacts of we started perhaps with just a handful of people, but that's the way it spreads, and that is the reason why this disease is itself so deadly, not because it has a high fatality rate, but it has a potential to multiply the number of people who are sick at an exponential rate, and then overwhelm a health system if that health system is not responsive enough. So we want to be very responsive. We want to be as fast as possible in interrupting it, and as early as possible, so that the pool of infected people does not, first of all, does not increase beyond control, and secondly, does not spread beyond the clusters where they are already located.
You, earlier in the week at the briefing, the Minister of Information mentioned that there are over 4,000 suspected cases that you are tracing, those who may, suspected case as it may be. How far have you gone in tracing? How many of these 4,000 plus have you been able to contact or get in touch with?
Well, as of now, I cannot give you a direct figure, but most of them are in the Lagos area, which is why you can see Lagos is receiving very special attention, both in funding and also in the directives that His Excellency the President just gave. The teams of epidemiologists and technicians who are looking after these, looking for these persons are working very hard. They are doing a yeoman's job, I would say. and in some cases probably assisted by security officials. But I can't give you a figure right now, but they are doing a very good job. And it is out of the findings that they make that you are able to see the number rise now from what it was yesterday to 97 today. It is not that there are new imports, because we have shut our airports, and the imports are no longer a contributory or a major contributory factor. But we are dealing now with the contacts who have already acquired this virus from the initial index cases, which will be the primary contacts. And then from the primary contacts, you can get the secondary contact. And there you want to have been able to control the spread and the transmission.
Honorable Minister, we understand what the WHO is talking about, and we know that you are following the direction and the guidance from the WHO. But quickly, let me get a sense of the contacts and the tracing you are making. The Lagos State Commissioner for Health, Professor Abayami, said that we're looking at about in the range of about 39,000 cases if social distancing is not adhered to. What is your projection in the coming weeks? Now that there's going to be a shutdown in 3 states of the Federation, Abuja, Abuja FCT, Lagos, and Ogun State, what is your own projection on the national level?
Well, yes, that's why I say that the measures announced by the president today are timely, in the sense that they have been calculated to come at a time when we need to raise the ante, raising the stakes, and being able to make sure that those numbers that are projected, those are dire numbers, 9,000, can be found and identified and isolated, so that they don't constitute a risk to the public. The whole idea, again, as I said, is to be able to make sure that you identify them, and by closing the risk, the channels of transportation outside of Lagos, you make it impossible for any of them, or at least you reduce the risk of any of them taking this disease to other areas which may be less ready, as Lagos has been. As you know, Lagos is a very well-experienced state in handling infectious diseases. So the risk of being able to transport this disease is the very reason for this lockdown that has gone on in 2 major entry points of the country. So I do believe that it's going to have a very positive impact on reducing the incidence of contraction of coronavirus that we are going to see in the country.
Honorable Minister, there is a case, and experts are saying that the more testing that you do, the more discovery of the cases you find. We've seen the cases in places like South Africa, in California, in New York. You've seen cases like that. What is the capacity of our testing? How much of the testing kits do we have? What is the capacity, the number of testing that we have presently in the country?
Well, as I told you, we have about 6 or 7 laboratories now that are able to test in the country. It does not mean that everyone has to troop to these laboratories. What happens is that samples are taken, and then they are transported to these laboratories, and within a matter of some hours, you get the results. So the capacity for testing is there, but we do targeted testing, in that we know very well that this is an imported antigen or pathogen, and because that's coming from another country, it is spreading in a way that not everybody is at risk, except those who have actually been in contact with someone who is positive. So therefore, if you do contact tracing and you find those who have been in close contact with a person who has traveled, or in fact, a person who has coming from a high-risk country, and you observe them that they are beginning to show symptoms, then you carry out a test. But it is not that you start testing the whole place. We don't have enough reagents for that. No country has enough reagents. And some countries that tried that immediately reversed, because they found that they could not keep it up. Just doing a blanket testing, it's not possible. It drains your resources, and you discover that you have a high rate of negatives, and you might in fact have a false sense of comfort. But the targeted testing is able to bring out those who actually have contracted the disease, who are showing symptoms of being unwell, and you can take those ones and put them into isolation. So in that way, you are economical, and you are more focused, and you have a higher yield of those who you want to put into isolation.
Before I go into, because there are some people who are showing interest of wanting to partner with the federal government and assist with their facilities, those private endeavors. But let me ask you, Honorable Minister, because you briefed about an aide of the president who tested positive for coronavirus. Is it that we don't have the capacity to treat those who test positive for coronavirus? Because we're hearing that an aide of the president or someone in power may be out of the country for treatment of coronavirus. Confirm to us, is it true?
To the best of my knowledge, nobody is out of this country for treatment of coronavirus. And I don't think that there are many countries now who will be willing to accept anyone coming from outside with coronavirus, because I think most countries have enough of their own problems. So to my knowledge, nobody has left this country for coronavirus treatment. The capacities here are being expanded every day. We have been carrying out conversations also with the private sector. We have been acquiring places that will be useful for patients should the case arise. We have looked at even hotels that we have earmarked to use. We have had donations of space and facilities that can be used should the number of those requiring isolation increase. So all those are being prepared, and I set up a team to look into all these places to accredit all those who will be fit to be used as treatment centers. As you know, this is a highly infectious disease. The pathogen is extremely risky and dangerous. So any facility that is going to be used for treatment has to be inspected and accredited. Professor Abayomi is going to lead the team that will inspect any facility that will be used and accredit it that is fit for treating the coronavirus infection. It's not every hospital that should be able to do that. So the private sector can only join if they have been accredited as fit and able to treat coronavirus cases, so as to reduce the risk for the healthcare workers and also for the public. As you know, if you do not have the discipline in a center and you let visitors in anyhow, they are all at risk into a corona treatment center. You also know that in many of the countries where they're having a very serious battle with coronavirus infection, a good number of healthcare workers have been affected and have either been hospitalized or they have lost their lives. So it is extremely important that it is understood that this infection is a national security issue, and not every hospital or every establishment can jump up and claim that they want to start treating this infection. They need to be accredited. We welcome those who are interested in participating in the treatment, because every attempt is welcome. But such a facility will have to be accredited according to terms of reference that will be set up by a panel of experts.
Honorable Minister, we will go on a break in about 60 seconds. But before we go on a break, give us a sense of those who are, there are a lot of Nigerians who are into herbal and alternative medicine, and those who are coming forward to say they found some kind of treatment for it. Professor Morris who is one of them, and a few people, others who are into alternative medicine. Are you considering and looking to the side of these people? If the American government or the president in America is saying hydroxychloroquine could be a possible treatment, are we looking internally?
Well, we're looking at every person who comes and makes a plausible or sensible claim that they have a remedy, which will be examined and scientifically verified. We also listen to what other countries are saying or doing, those who are proposing various forms of treatment, including those that were previously known to treat malaria. The decision actually will come from experts. I've given ethical approval for Lagos to look into the efficacy of chloroquine and hydroxychloroquine to see if they actually do reduce symptoms or are helpful in a cure. The result of such clinical test, as they now are, will add to the body of knowledge on what can come out of chloroquine. As for herbal medicines, well, a lot of it is a matter of faith and a matter of belief. Those who try herbal medicines, which they know, are welcome to it. But I also would like to warn very clearly against charlatans who probably want to seize the opportunity to offer you things that won't work, especially if they make you pay for it. Anything you take has to have it tried and tested scientifically and known to work. Otherwise, I will advise against being used as for experiments.
All right, let's take a breather. Minister, stay with us. We'll take a break. But before we go, as news of those who made contact with those who tested positive for coronavirus came to town, some politicians are speaking about their tests and their status. The governor of Kogi State also went on social media, and this is how he showed, how he said he's fit as a fiddle.
I got no COVID.
Thank you so much, everyone. Welcome back to the program. Just to let you know that some of your questions, we can take them. Don't forget to let us know what your views are on the issues we are discussing tonight, how we all can keep safe. Twitter us on these handles. Write to us politicstoday@channelstv.com, our email to these handles at CTV Politics, and we'll be taking some of your questions. The Minister for Health, Dr. Osage Ehanire, has been speaking with us from our Abuja studio, giving us sensitizing Nigerians on what to do, especially a few minutes after the President Muhammadu Buhari gave a nationwide address on what needs to be done. Honorable Minister, thank you for sparing some time with us tonight, at least to get Nigerians abreast of some of the things that you are doing. Just to clarify, from the presidential order today, from the speech, the restriction of movement, which he said in Lagos, Ogun, and FCT, is going to be for the next 14 days. It then means that Easter will be spent in our homes. Is that the case, Honorable Minister?
Well, I haven't thought about that, but if that is the case, that's a very good thing to do, that to spend Easter at home and be able to be with the family. Probably downtime from work for some people. But on the whole, as I said, if it's a sacrifice for some people, it is well worth it. The country requires really to have most of the citizens in Lagos and Abuja to be in their homes, and Ogun State also, in order to reduce the risk, because there is clear evidence that the more people mingle together, the larger the crowds, the denser the crowd, the higher the risk of transmission of this disease. We have seen that in various other countries, and we have also seen measures that other countries applied in order to be able to tackle this outbreak in their own places. So that is a very good and worthwhile sacrifice if you have to spend Easter where you hadn't planned to spend it. But I advise that everyone makes the best of the situation.
Indeed. Let's talk. I understand that you had a teleconferencing meeting with some state governors, and give us a sense of what you're planning aside the exclusive relationship that you are having with Lagos, Ogun State, and some of the policy that you're making in the FCT. What are the other integration or cooperation with other states that you're having? Is there any plans for other states that are having these cases?
Yes, I was privileged to be in a teleconference with state governors today, and we had the opportunity of exchanging ideas. They raised many questions that they felt needed to be clarified, and also some of the anxieties that they had. We were able to address most of them. But again, you are correct that the main focus has always been on Lagos, Ogun, and Federal Capital Territory, particularly Ogun and Lagos, who have a very wonderful cooperation arrangement. They work very well with each other. We're very happy that the original index that came in was handled very well in an exemplary way, that the World Health Organization, in fact, did commend our country, that the index case was found within 48 hours. The 179 contacts were traced and zeroed down put into isolation, and one case was found to be positive. They were both treated, they were discharged, and that would have been the end of the coronavirus at that point, but other cases came in large numbers, and those are the ones we are dealing with now. As for other states, the risk is the seeding out of people who have contracted this infection from Lagos and Abuja. They are the international airports where people come into the country, and then they now move from there to other states. So the seeding out to other areas, that is a challenge. That is how the infection will get to Edo or to Ekiti or to Oyo or any of those other places where you have it in about 10 states right now. So the governors there, we briefed not to panic, but to focus particularly on case finding, identifying those who have traveled, and then their close contact, putting all of them, as many as you can find, into home or supervised isolation, and anyone who has a symptom is tested, and if they are positive, they are sent into treatment. If you are able to do that very well in all the states, then we shall reduce the risk of explosion in the states. And if we are able to confine let us say, the enemy, the coronavirus, to the points of entry and handle them there, we will have done very well. Handle them in Lagos and FCT and Ogun State. So we'll have done a good job in containing the infection. So the name of the game is containment, and the various strategies that we have spoken of so far go towards that objective.
Honorable Minister, we have the next few minutes, and I would like to take some of the questions from our viewers. Some of them they're sending in now. Let me first and foremost, before going into that, ask you, the disbursement of the money is about 10 billion naira the federal government talked about. The president said he is going to be meant for this curbing of coronavirus. Has that money been disbursed?
Yes, the money is largely meant for Lagos. As you know, Lagos is taking the brunt of it in the country. The fortune in the misfortune is that the authorities in Lagos have good institutional from the 2014 Ebola outbreak in Nigeria. They handled that very well. Governor Fashola has been advising me with providing me with the benefit of experience for that period. It's very helpful indeed. And so they are handling it very well, and they're doing a great job. So the bulk of the money goes to Lagos State. Most of it is actually a refund, because they have spent a lot of their own resources in dealing with this case of case finding and tracking and testing. All the laboratories in Lagos are working very well now. University of Lagos Teaching Hospital, Nigeria Institute of Medical Research, and a biosafety laboratory in Yaba. By Monday, they should all be working full stream. I have ordered that they should work around the clock, work in three shifts, of scientists, so that testing can go on non-stop continuously. So as the cases are being found, they are being tested, and measures are being taken. Lagos has opened up a large men's center now inside the city. So they are doing very well in that respect. But the resources for other states will come in as the need arises. But in their own case, the effort should be in trying to limit the incidence of this virus in their states, and also intensify the tracking, so that they are able to prevent this virus from settling the way it has almost settled in Lagos. Lagos has suffered a deluge of cases, and they are trying very hard. We hope that they will get all the benefit of the funds they have received, and be able to. The more successful Lagos is, the more they spare other states of infection.
Honorable Minister, I have about 3 or 4 questions, but if you can help me wrap them up in about 3 minutes or thereabout, some of the questions from our viewers. One of it is that people want to know those who have been discharged. How many of those who were treated? And you told us earlier in the week, last week, that some of them have gotten well. Have they been discharged, and how many of them?
Yes, the last information I got is that 3 people have been discharged. People do get well from coronavirus infection and they are discharged, but before you are discharged, you are tested, and if you are negative, then the test has to be repeated in 1 or 2 days, and if you are negative twice, you can be let go. So that's the WHO recommendation, that you have to have 2 negatives for the virus before you are released to go home. So there are successful stories coming out of our treatment program. Other countries have also had very successful treatment programs, and they have discharged a large number of people. So we know that it's curable, it's treatable. You have to be able to get the cases early enough, and also make sure that actually, as much as possible, all the vulnerable population are kept away from risk of infection.
Another question from one of our viewers is the fact that for those of them who do not have the capacity to stockpile food at home, especially in Lagos, Ogun, FCT, for 14 days, what should they do?
Well, the president in his broadcast did announce the activities that are going to be put in place to ameliorate the fallout of these restrictions, particularly the inhabitants of satellite towns to Lagos and Federal Capital Territory. The NEMA and other agencies that are responsible for taking care of food and humanitarian activities and affairs will kick in to ensure that they give basic and necessary supplies to those who have access to it. But again, I do believe that a large number of persons who have seen and heard stories that something like this was going to happen have started to stockpile. And in fact, I was assured that a lot of people have already stockpiled food and items that they will last them a month. I know someone who told me that they have stockpiled food for 1 year. So I hope it doesn't get to that level, but I do believe that those who have not stockpiled will be able to get help if they call for help, particularly those the president identified as being in the satellite cities to Lagos and Abuja.
Let's go now, Honorable. We have to leave it, but this critical question, if you can help me handle it in 30 seconds, is about the call centers, the numbers that you have released. Some people say they have problems with relating with those or getting through to the centers when they needed them. Have you resolved some of the issues with these call centers?
Oh, yes, we have heard of that. There are calls that are coming quite a lot, in the thousands. I believe by now the calls are, I think if I recall correctly, up to 4,000 calls that are coming. And the NCC, working with NEMA, is trying to link up the national emergency call of 112 to the NCDC number of 080097000010. If you connect the two, you can have more lines available. The lines do get clogged up because of so many calls coming in. The communications experts are working on seeing that 112 is an alternative for you to call. That is a national emergency number. If you do not get through on that rather long number, 12-digit number of the NCDC, you can try 112, and from there you can be connected automatically to someone who will help you. We have also had volunteers who have come in to be trained to work as dispatchers and help you with these calls, or link you up to people who can help you with the calls. Yes, the problems at the beginning can be there, and we wish to apologize for them, but they are due to very high demand, and remediation is being made. I think that within the next few days, the difficulties with calling in will reduce or be eliminated.
The questions are coming, the deluge, so much of them, they're coming so much, but that's how far we can go and so much that we can take. Honorable Minister for Health, Dr. Osage Ehanire, such an interesting time in the history of humankind, but indeed we appreciate the time that you spared tonight, and we hope that in the coming days you might also come again to sensitize Nigerians on what needs to be done. Thank you indeed for coming tonight.
And thank you. We gladly do this. We need the citizens to be on the same page so that there is a better understanding, and also to assure citizens of transparency and accountability here, and to ward off the fake news that tends to proliferate at this time and under these circumstances.
Thank you so much.